Hello, thank you for asking me to speak to you today. I'm sorry I can't be with you in person, but I was asked to talk about faith and mental health from a public health perspective, so that's what I'm going to do. The first thing I'm going to say is that it will become apparent that I'm speaking about faith from a Christian perspective as well as from a public health perspective. I'm not suggesting that what I know is any better than any other faith. I'm just saying this is how it is with me and how is it with you. I think one of the things that we really do need to do when we're addressing faith as a public health issue is that faith communities need to think theologically about their issues. So I'm going to share with you some of my experience over about the past 15 years of trying to do this. Around about 2008, working with the Department of Health, I did a survey of every NHS trust in England and Wales, and we asked them about diversity. And the diversity strand that they found most challenging and most difficult, some actually said they found it embarrassing and awkward, was faith. I'm not sure things have necessarily changed that much, but it does seem to me that unless we actually really get to grips with this issue, we're not going to get very much further forward. So what would a public health approach to faith and mental health look like? Well, I have several pointers. The first point is that actually we need to take faith seriously in public policy. There's very little data about faith. There's very little data and routine data about it. There's not an awful lot of evidence about the crossovers between different protected characteristics, so ethnicity in faith, gender in faith, and so on. Most people are not just one protected characteristic. We know that most people are 3 or 4. So one of the things we have to do in public policy is really take faith seriously on its own merits as a diversity issue. I think the second thing we need to do is we need to articulate that actually faith has a value in the public square and faith has a role in the public square. And we know that, for example, faith communities make significant contributions to the well-being of our society. An audit in the Northwest in 2007 suggested that faith communities contribute £97 million a year of added value into their local economies, and that's just in the Northwest region of England alone. So firstly, faith has to be taken seriously as a public policy issue, and we need to articulate to policymakers what that looks like and what we want. In order to do that, though, I think we need to reflect theologically. There is absolutely no point in actually just saying it's another issue without understanding for ourselves why we are interested. And that, I think, brings me to my second issue on faith and mental health. There is a whole load of scientific evidence that faith and mental health interact in a number of different ways. Firstly, faith can be a protective factor. It can help people cope. It can help people be resilient. It can help people make sense of their lives, and that's the case with me. Secondly, every major world religion has a discourse about human flourishing. So in the handout for today, you will see I've given you some links for reading where it talks about the Quran making a number of statements about psychological flourishing and well-being. And I certainly know from my own Christian tradition that flourishing and well-being is a real tradition within our theology. The problem is actually we haven't obviously or often expressed that well, and sometimes actually we've been our own worst enemies in not sharing that. So faith has an awful lot of positive things to say about mental health, and if you read Alan Idler's book on religion as a social determinant of health, you'll see that. Faith can also be a factor in mental ill health. I think that's been overplayed in treatment and therapy and overplayed in the literature. And actually one of the things we really have to do is recover a much more nuanced sense of the role of faith in health at individual and population level. Most people of faith understand their health and their coping with ill health through their faith and their religion. That has to be something which we address clinically and in public health terms. I'm going to move on to the third point I want to make, which is, so what are the key public health components of an approach to taking faith seriously in mental health? Well, from the work I've done over the past 15 years in a Christian context, I think the first and most important thing I'd say is actually get your science and your theology talking to one another, and build a kind of an authentic Islamic approach to where faith interacts with mental health, and actually dialogue it with the science. The Islamic tradition has a long history of engagement with science, because we know that actually Western science and Western mathematics and even the numbers we use actually are significantly indebted with that. So we know that that can be done, and I would encourage you that that's a way to go. The second thing is actually promote routine collection of the data among policymakers. The third thing, I think, is foster research and get research beds in. So the University of Leeds has a Muslim mental health project. It also has a faith communities project, and they're run by two separate departments, and I've given you the links in the handout. The next thing I think we need to do is develop good practice models. So Faith Action has a Friendly Places Charter for mental health. Livability has a whole mental health access pack for churches to use in helping people from well-being to resilience and beyond. Can you produce authentically Muslim versions of these that deal with not just faith, but with the impact of racism, the impact of intolerance, and the impact of misinformation about your faith? I think the next thing is, it's actually not just chaplains, it is everybody's business. So every single member of the health service needs to be able to address somebody's needs sensitively, whether that person's an atheist, a humanist, or a person of a religious belief. That brings me to my fourth point. If we know what good looks like for faith communities, well, we need to know what good looks like for public health. And we need to know how we value people. So I've talked about what good looks like in terms of components of public health. In faith communities, what do we need to do? Well, I think there's three principal things. One is actually we need to build our faith communities in a way that they promote mental well-being and mental good health and psychological well-being in a way that authentically fits with their understanding of who they are. So things like the Friendly Places Charter, things like the activities and so on, and they promote resilience. And there is a role for spirituality in that. The second thing faith communities need to do is actually look at how they can support people in their communities who have mental ill health or are coping or are on a recovery journey. And the third thing is that public presence to policymakers and others about their role, their value and their contribution. We can't have a multi-dimensional, very diverse society without taking seriously what faith means. And faith, I think, for a while was a dirty word in the public sector. Well, we need to make it not be such, because they're missing a trick by not talking to us. So we need to know what good looks like for faith communities. And we need to articulate that both internally and externally. My fifth point is actually we need to value people working in health who are of faith. So I have humanist colleagues who do their job because of their values, not because of their money. And it's the same with me. I don't do my job simply because I do my job. I do my job because it sits with my value base and it feels to me like the job I've been called to do. So how do we own and value that? A few years ago, I started sending a guide around every NHS trust in England called How to Make Religious Diversity Work for Your Trust. It's interesting, I think, that companies like Tesco's and Barclays have done better on really understanding the religious diversity of their staff and the complex diversity of their staff. So, people from black and minority ethnic communities of different faiths, people who may be LGBT and of faith or whatever, they've done a better job than we have. We have some catching up to do, and we need to articulate that agenda. And we can't allow simply one diversity agenda to dominate all our diversity discourse. We don't do well in this country on disability. I don't think we do that well on race. We certainly don't do that well on learning disabilities. But actually, people of faith have all these characteristics, and we need to do better on mental health. This brings me to my final point, which is I think we need an adult debate about our values. There is no point in taking a one-size-fits-all approach to people who've got issues ranging from drug and alcohol issues to anxiety. For every one person who understands these issues and their challenges purely in terms of the organic causes and consequences of them, there will be another person who understands them in terms of their values or in terms of their faith. We actually need our society to be able to respond to that and take faith as an asset, not as a problem. And that means we need to encourage clinicians to be able to discern what matters to the person in front of them. When I had cancer, actually, what mattered to me partly was the treatment. But what mattered to me much more was actually making sense of that and what would be the issues in my future, because I knew that the treatment was going to functionally basically cure me of my cancer. So the issues about meaning were far more important to me than actually the significant, but in some sense fairly minor, side effects of all the treatment. How do we build that into mental health? So to conclude, I think we need to stop seeing mental health as a problem and stop seeing faith as a problem and actually have a much more nuanced discussion. I think your job is to articulate what that means for you as Muslim communities and what that means for the population. The more we take this seriously, the healthier our population will be. I'd love to continue this discussion with you, but I hope that gives you some pointers, at least from the journey I've been on, that resonate with you. Have a great conference, and I wish you every success, and thank you for listening.